I am an environmental and health consultant, and I do three different types of work. I do a fair amount of research that looks at buildings and people's health. Started long ago with lead, and I've done a lot of work on asthma and breathing issues in buildings. And then I do a third of my work on policy for the federal government, EPA, HUD, International Energy Agency, on health issues related to buildings. And for the last 8 years or so, I've been very interested in this intersection of energy efficiency and health. And the third thing is I do a lot of work with programs and policies and private property owners. I've sort of been the indoor air quality person in a lot of green building standards. So I work with owners developing new properties, a lot of green and healthy property management, and a lot of work with energy efficiency programs around the country who are rolling out services and how to integrate health. And I love to be interrupted. So I haven't heard a single comment. I know we're going to have questions, but if I say something, and I hope to be slightly provocative, please say something back. Let's have this be a little more of a conversation, because success for me is that you've learned 2 new things and that you've taught me 2 new things. So I've learned some stuff from these guys. I'd love to learn some stuff from you. The 2 things that are really motivating me right now, and I think these are 2 big forces in society, is one is healthcare, right? We are spending $7,000 a person per capita on healthcare in the United States. That is the highest of the Western countries. We have a bold new plan related to healthcare in this country, and the fundamental thing that Obamacare, the Affordable Care Act, whatever we want to call it, is doing, aside from access, is that we are now going to, this is a gross simplification for anybody who's a healthcare expert. I'm going to take liberties and summarize this act in 1 minute. The general view of it is that we are now going to pay the healthcare system to keep us healthy. Used to be the healthcare system got paid by administering services when you were sick, right? So I got paid for doing a test, I got paid for giving you a drug, I got paid for a hospital visit. The fundamental big shift is 2 things. One is they're going to get paid on a per capitation basis, on a per person basis, to keep people healthy, right? So that incentivizes a whole bunch of other practices that you already know are smart that could get paid by healthcare. The second thing that's changing in the Affordable Care Act is that those services no longer have to be offered by a doctor or a nurse or a physician's assistant. Now, a doctor, a nurse, or physician's assistant can recommend a service that's offered by somebody else, like Paul. It could be that it is entirely legal, whether anyone will choose to take advantage of this, it's entirely legal now to say, I have an asthmatic, and we know based on talking to the doctor that there may be things going on in that person's home that are exacerbating or making their asthma worse. And it is now possible to write a prescription for Paul to come in and do asthma environmental interventions, which I can tell him exactly what to do, and tell him that for usually $3,000 I can reduce your risk of going back to an ER by quite significantly, and it's a good return on investment. So it's now legal. So that opens up a whole brave new world for us. The other thing that's really motivating me is climate change, and I don't have to convince you guys. I would say in my volunteer time, I wouldn't say, in my volunteer time, I am the co-chair of the Wayland Energy Committee, so I am highly motivated, and we just passed a big ESCO Energy Services contract to do 8 of our buildings and upgrade energy efficiency for $2.8 million, and I know how hard it is to get things through town government and town meeting, which we have in Wayland, and we're looking at doing 3 large solar installations as well, and we're changing out all our street lights. 400 of our 800 are still incandescent bulbs, which means you have great opportunities for savings. So I like to put these 2 things together, energy efficiency, climate change, and health. But let me just say I really come from an analytic and a science background, but you shouldn't always trust scientists, and here's why. So, you know, we have good ideas, but you need to be careful when we put them into practice. So the first thing I think I want to say while those slides are coming up is, let me ask a question. If we said we're building a LEED certified, we're building a green building, would we assume that it's healthy? Yes? Raise your hands, yes, if you think yes. If you think no, raise your hands. All right, a few skeptics, which I appreciate. The answer is, of course, maybe, right? Just because it is a green building does not mean that it is automatically healthy. All these green building programs have those two tiers of things, which is things that are required and things that you get extra points for, and you have to tally enough extra points to reach the certification that you want. And some years ago, about 6, I did maybe 8, I did a study that looked at all the green building programs and sort of evaluated them for health. And not surprisingly, the ones that were very health-driven, like EPA's Indoor Air Plus, which is an add-on to their Energy Star program, scores better because it's all required, versus LEED, which is not, and I help write some of the LEED H standards for homes and the Enterprise Green Communities and lots of other green building programs. So they're not automatically healthy. Let me ask this other question. How many of you are here because you're really interested in your own house and single-family residential? All right. So, and how many of you are here because you're thinking about municipal buildings, larger scale buildings? Okay. All right. Good. So I have these in the right order. That's lucky for me. So why? And you guys are welcome to move to, not Crane if you want to. The way I think about making homes healthy is that you got to think about 3 things, and it's pretty basic. But before I get to the 3, I just want to give you epidemiology. Anybody here go to public health school? Because I'll offend them in a second too. I'm going to teach you public health school in a minute. I just taught you ACA in a minute. Here's public health school in a minute, which is you get sick 3 different ways. You eat stuff, you breathe stuff, and you touch stuff. That's how the exposure works, right? That's inhalation, ingestion, and dermal contact. But in English, you eat stuff, you breathe stuff, you touch stuff. There's 2 other, and what we want in our buildings, we want less bad stuff to breathe, touch, or eat in our homes. So things that get on our hands that then go in our mouths is sort of an eating thing. The other 2 things that I think about for health increasingly are mental health, sort of stress-related things, and there are certainly things in buildings that create more mental health and stress, and we have a whole body of research about mental health and stress and how that affects our health. And the last one, the positive phrase of this is active design. We should design our buildings. We actually have to get up and move, right? The negative would be inactive design. And I want to give just a teaser on that for a second. I do a lot of work with multifamily property owners for very high-end housing and for affordable. I have like no middle-class clients. And I don't know why that is, but in some of, you sort of say, like, how does active design, remember, I'm trying to put health together with energy efficiency. So how do I do that on active design? I'll just look at Ellen, who designs buildings, and say, because I can't remember your name, I apologize. When I do a retrofit of a building and the stairways were traditionally sort of darkish, now I put in new bi-level lighting, which is at a low level most of the time to meet the code, and when someone walks in, it bumps up to a brighter level. I get much better use of stairways for walking. So there's a really interesting example of where an energy efficiency thing can actually produce a much better health outcome, and you sort of get a twofer. So we want to think about kind of where we can get twofers. So let me, now that you understand Public Health and Affordable Care Act, let's go into healthy housing. So what are we trying to do? The first thing is, in all environmental work, is source control. It's not bad for you if it's not there. So the most important thing to do before you think about ventilating and all kinds of fancy technology is don't have the darn bad stuff in the building to begin with. And and the biggest ones of those, and we've come a long way in this, right, is getting rid of environmental tobacco smoke in buildings. Banning smoking in buildings was probably the #1 best public health thing we could ever have done, because for those people who design buildings and ventilation, we know we can never ventilate a building to actually prevent the movement of smoke from one area to another, because the needs for compartmentalization are so challenging, right? So not having the darn stuff there to begin with is important, and increasingly there are lots of ways at looking at product specifications to make determinations about whether it's a bad thing or not a bad thing. So if we are coming up with a new building, or you're retrofitting your house, or we're retrofitting, like in Wayland, our schools, any new thing we are putting in, we have got to be careful, because if we make a mistake there, I'm going to have to find a way to dilute it and get it out of there. So if I had to say the #1 thing, it's don't put it in the beginning. There are some things that are legacy compounds that exist because somebody else put it there in the beginning a long time ago. So lead and asbestos are good legacy compounds. So to the extent we're doing renovations, we really need to be careful about those legacy compounds. And there's quite good guidance about how to deal with those things. But when we're doing energy retrofits, I have some data from some projects that have been done where we've created lead hazards as part of doing our energy retrofit. We've messed up in the way we touched asbestos. So there are legacy compounds that you just want to be careful of, and I'll talk a little bit more radon in terms of people's homes at the end. So if I have less bad stuff in there and I haven't messed up the legacy compounds, then the other thing I want to do is, to the extent the building operation itself is generating things that are bad, I want to get them out of there, right? So that's the combustion appliances. We still have to heat and cool, and we tend to, other than PV, we're still using a fossil fuel to do some of that, and it's creating some byproduct of combustion, carbon monoxide, nitrogen oxides, all of those nitrogen oxides that come off, let's say your range in your house. Nitrogen oxides come off your gas range in your house, and those put you at increased risk for breathing problems, and particularly for COPD, which affects sort of the elderly. So anything that if I'm generating something that is creating that byproduct, I better have a way of getting it out of there. You know, when we built houses long ago, the first things we did, we were in caves, but then we were in teepees. And when we were in teepees, we had fires. And what did you always make sure you had at the top of the teepee? A hole, right? So here's the thing. You got to remember the teepee. We're building buildings that are complicated now. And we've become so distanced from actually the way that they work. And I do worry about this as we're getting more and more complicated, is that people don't, I have 3 kids, and my middle son's a chemical engineer, and his training has taught him nothing. It's taught him first principles. When you get a complicated, any engineers in the room? Yeah, so you guys, you learned how to think. And one of the first principles I want to leave you with is, don't bring bad stuff in. If you produce bad stuff, have a way of getting it out, either through direct ventilation or through dilution and air changes. So think about that in everything you're specifying. So we're going to capture bad things from heating and cooling generation, and also another bad thing is moisture. We do in a lot of buildings, so we get moisture in a lot of different ways. We breathe, that's one way. So in overoccupied buildings, we get a lot more moisture. We, in our homes, we shower, we cook, and our basements in New England tend to be a little on the damp side, I would say. All of those things are creating moisture, and the other big source of moisture is what? Where's most of the moisture in the world come from? Rains and snows here, right? And after a winter like this, you saw a lot of ice dams and you saw a lot of leaky roofs. So we have a lot of buildings that get moist on the inside because of those problems. So one of the things that we want to do is, if there are moisture problems that we've created, again, we want to exhaust that moisture out, and we want to prevent it from getting in the first place. So let's look at some data. I'm going to show you, and then the third point is, so we're going to not have bad stuff, we're going to exhaust the bad stuff, which are contaminants and moisture, and then we're going to do dilution. Whatever's left, I'm going to bring in clean, fresh air to get rid of. So I'm going to start with some slides about how good is this ventilation thing. You guys are making buildings super tight. I love that, right? We're going to make them tight, and we're going to ventilate them right. So how important is ventilation? We have the best data for offices. Second best is schools, and we have kind of crappy data for housing because it's really hard to do this kind of research. So let's look at a few little things. So not to geek you out too much, I'm a little on the geeky side, so not everyone's a scientist. Not everyone likes graphs here, but let's just take a look at this. The reason office data is pretty good is because in offices we collect data about people missing work because they're sick. That's something data that's regularly collected, which is why it's better to do these studies. This is a very large study of 40 buildings. It's actually Polaroid's facilities in Massachusetts, not their manufacturing, but office stuff. And you can see that as we increase ventilation rates, right, from 24 CFM, that's cubic feet per minute, to 48, we reduce the amount of time people are out for short-term sickness. Long-term sickness is sometimes other things. Short-term sickness, we think, is more related to your direct exposure. So you can see that as we increase ventilation, people are sick less. right? Now, there may be other things going on, but we see that in that study. And then in schools, we measure missed days for schools, but the other thing we measure in schools is your performance on a test. So this is 5th grade classrooms, and this is pass rates with increases in outdoor performance. And the percent increase per liter per second of ventilation. I don't want to get too much into the math of this, but we see a substantial improvement in both math and reading scores as we increase ventilation. Right? So we can see that both people are less sick in offices. They are doing better in school when we increase ventilation. So it is important, and there's a bunch of other studies on this. I just kind of pulled a couple here to show you that we do see some improvements in performance when we ventilate. So paying attention to ventilation when we've made things tighter has to be, although it's third on my list, right, get rid of bad stuff, then ventilate point sources, this dilution thing actually works, and you've got to build it into your structures. What the studies don't show us, I would say, is what's the exact right ventilation point. That turns out to be more of an art than a science, precisely because you never know exactly how many people are going to be in there. You're designing it based on a per square foot basis, and you're making some assumptions. So I don't think we have research that says it's this number versus that number, but we know very underventilated buildings, we get a lot of sick building syndrome and people reporting health problems. Super overventilated buildings, I might be paying an energy penalty for, because some of this mechanical ventilation is, even though we'll do it efficiently, is costing us in some energy way. I don't have the exact right number per se. I wanted to just put this up for a second, because one of the things that, actually I think I want to come back to it. No, this is why I have it here. So ventilation in offices and schools matters. I wanted to talk a little bit about homes as well, which is when we think about what we're worried about in terms of health, one of the top ones that we have to care about with buildings is asthma. So about 10% of the population has had asthma at some point in their lifetime. Who in this room has had asthma at some point in their life? All right, so I count 5 hands, and I don't know how many people are here, Mark, but maybe 50? So you're about 10%. How many have had a family member who's had asthma at some point in their life? All right, so that's maybe a quarter of you or a third of you. The data in New England is about 10% at some point in their life, and in families with children, 20% of households who have a child have had at least one child in that household has had asthma at some point in their life. So from a public health perspective, this is an epidemic. I mean, this qualifies as a public health epidemic. Now, why am I talking to you about that related to housing? What we know about asthma is rates have doubled since '85. We don't totally understand it. But when you really look at the research, about a third of the cases have a genetic component, a third of the cases have an environmental component, which is why I'm going to tell you about it, and about a third of cases I have no idea what's going on. So that's sort of the gross generalization of the data. But in terms of the part with the environmental triggers, what we know is that dampness has a significant association with asthma. People think it's mold giving us breathing problems, sort of Stachybotrys, the black mold. And what we know from this very, very large study done by the National Academy of Sciences is that if you live or work in a building with chronic dampness, you are at a 30 to 50% increased risk of a bunch of these breathing problems. So you do not necessarily need the presence of mold. Now, you can't have mold without dampness, right? But just dampness is bad for us. So when we are designing buildings, I'm really always thinking if I had to fix one problem, it's dampness and moisture. That's the number one thing I would worry about from a respiratory health standpoint. So we have, and I put that in there because this takes us to a Swedish study that looked at increasing ventilation rates and the odds ratio. That means the likelihood you're going to develop the problem. And in this case, the problem is asthma and allergies. And you can see if the odds ratio is greater than 1, that means you have a greater than an even chance of getting the risk, right? So if you're at a odds ratio of 2, you're twice as likely to develop asthma if you're in a home with a very low ventilation rate. So you can see as the ventilation rates go up, the odds ratios go down, right? As I'm ventilating more, my risk of having an asthma or an allergy problem living in this Swedish home goes down. Now, again, you'll see they start to level off at some point, so we believe there's a point where you're probably over-ventilating. These are Swedish homes which are pretty tight and are closed a lot. It's cold there, so there aren't, have a long winter, so you have to, maybe not so different than our climate. So again, another piece of data saying that ventilation matters. And if I haven't, I'll beat the drum a couple of more times, which there's another study of children in Norway that says if you have at least 0.5 air changes, you have reduced risk of allergic reactions. And I don't think I want to talk about that. I want to do it here. So we've talked a bunch about asthma and increasing ventilation because we want to reduce asthma triggers. This is a very large, actually not large, this is a study of 108 relatively new homes in California that were built, and some of them were built with ERVs, energy recovery ventilators that are giving us constant air changes that are sort of black boxes that are exchanging the air without an energy penalty. We keep the heat, we keep the temperature the same, we bring in clean fresh air, and you don't pay an energy penalty. And some of them had ducted outdoor air systems, which are bringing in clean fresh air, but you do pay an energy penalty. You have to reheat or recool the air. So when you look at a chart like this is looking at formaldehyde, which is something we care about for cancer risks as well as allergic reactions. And you can see that sort of, although there are a bunch of these blobs, they're kind of going down, right? So as we increase the outdoor air exchange rate, as we move from the left to the right, my concentration of formaldehyde goes down, right? So sort of another piece of data saying basically dilution works, right? If you bring in clean fresh air, you have less of the contaminant that you're worried about inside. This study also, it's hard to see it because there's a lot of little dots here. You'll take my word for it. What it showed was that these ERVs work better than the ducted outdoor air systems. Now, that people argue that these ducted outdoor air systems weren't well designed in this California study, but if you have a system that's really regularly bringing in clean fresh air and you're very confident it's doing that, this is what you get. If you have systems that need behavior interaction or that are not as predictable, we're not as likely to get this kind of result. Canadian study that looked at new energy efficient homes, and some of them added mechanical ventilation with an HRV in a more of a heating climate, and they did a health questionnaire at point A, and a year later they did the health questionnaire a year later, asked people about their general health, sinus infections, hospitalizations, stuff like that. And what they found was a year later in the homes that had this ventilation on top of the energy efficiency, so the homes with the ventilation are the EE homes. The control homes have energy efficiency but no ventilation, and there is a difference between the homes that have ventilation in terms of less of the negative means less of these problems. 28% reductions in runny nose, 30% reduction in throat irritation, 37% reduction in fatigue, and the difference between the homes that had the ventilation and the homes that didn't is shown with the p-value. For the statisticians in the room, you want your p-value to be less than 0.05 to mean that that difference is statistically significant, not likely to random chance, right? So it's saying, yep, in fact, those differences are real. We can look at some data from multifamily buildings. This is a study in California by Bill Fisk at Lawrence Berkeley Lab where they added energy recovery ventilators and some additional ventilation in bathrooms. I won't go through all the details. And what you can see when you're looking at is percent improvement. And if we look at the top, VOCs are volatile organic compounds. It's sort of a whole bunch of category of chemicals that can give us allergic reactions and breathing problems. Let's look at formaldehyde again, and acetaldehyde, also a carcinogen. PM 2.5 is actually pretty interesting. These are teeny little particles. This is sort of smog, teeny little particles that we can breathe. We used to regulate just the medium size, PM 10. Now we regulate these teeny little ones, PM 2.5. So this would be things that we might be getting from the outdoor air, from traffic, as well as from our cook ranges or somebody smoking inside. And basically what you see is generally a pretty good improvement in a whole bunch of things when you add ventilation. and this is ventilation and energy efficiency combined. So I won't get into the details of everything they did, but again, a message that energy efficiency and ventilation is giving us health benefits. Everybody with me so far? Yeah? Okay. I wanted to just go into homes for a second, because I know we have some people interested in that. This is some pretty interesting new data. I hadn't really thought much recently about nitrogen oxides, but there's some interesting data about gas stoves, which is, how many of you have a gas cook range in your house? I do. I like it for cooking. It's responsive. It's great. The electric ones used to drive me crazy, right? These data make me think about my next stove is going to be a convection stove, exactly to avoid this problem. So you get nitrogen oxide concentrations off your stoves, and you get every 20 part per billion increase, which is not a huge increase, a small increase, results in increases in symptoms that you can see up there in terms of coughing, wheezing, nighttime asthma. And as I said, for older people with COPD, which we definitely see in part of our population, is definitely linked to increases in nitrogen oxides. So what do you do to make it better? This is a study in Baltimore and some lower income housing. Easiest thing is if you replace the gas with electric, yeah, you get a benefit. That's not a surprise. I've removed the source. That's source control, right? And we see an improvement, interestingly, in the kitchen and in the bedroom, right? The bedroom's not in the kitchen, so that we're seeing a benefit in the bedroom is interesting to me, that there was enough movement of that contaminant. They tried some other things, some HEPA air purifiers in people's homes, and we saw a decrease initially, but then it didn't persist. So what that tells me is this behavior change thing, right? We can give somebody something to do or tell them to put the fan on in their bathroom, to run the fan after they shower, but behavior change is really hard. Behavior change is really hard. Personally, I'm into engineering controls. You know, as the mother of three well, they're now 23, 21, and 17, but you know, having parented teenagers, behavior change is impossible as far as I can tell. And if I could just make the shower stop providing hot water after 12 minutes, that would really make everything move faster in our house in the morning. I mean, it works that way by itself because we run out, but I like another way. The other thing that's interesting, it was for me just interesting note, is they installed ventilation hoods. You know, we put fans on by the gas stoves to say, oh, that'll do, we'll put a fan on. Turns out that made almost no difference. The ventilation fans for your stoves aren't actually designed to improve indoor air quality. And you know, the bigger they look and the noisier you are, you think they're really cool. There's really pretty much no correlation with how well they work. So there's an effort to completely redesign standards for these fans. It has more to do with how close it is to the flame and a variety of other things. So if we think that that fan is going to make a difference on these contaminants, we really have, the data suggests that we're wrong. The data does suggest that those fans can be pretty effective in controlling moisture. So I still run my fan because I don't want to create too much moisture when my home may be having more moisture than it needs. You know, you can measure the moisture in your house. You get a little hygrometer. You can get it to Ace Hardware for like $12, and you want it between 30 and 50%. And we have them in a couple of rooms of our house because I'm always interested in how it's looking, and you can see the difference. So if you're someone's got breathing issues, you want to sort of in that nice 30 to 50%. Below 20%, asthmatics have a lot of trouble, and you get nosebleeds, and if you wear contacts, it feels terrible. So that's the deal, nitrogen oxide. We were talking about moisture earlier, and I just wanted to show one little chart. Again, we're in people's homes here, which is that if you have a fan in your bathroom, the question is, we make a lot of moisture by showering, for sure. Certainly my kids shower way too long. So how long do you have to run the bathroom fan? Here the research and our outcome measure is that the bathroom mirror is clear of fog, right? That tells me that pretty much I've gotten rid of the moisture. This is the plain English study. And what it shows us is that you have to run the fan for 30 to 40 minutes to really get rid of. So Tina's looking at me like, really that long? Yeah, really that long. Of course, the biggest variable was whether the door to the bathroom is open or closed, right? Just think about it. So we have bathroom fans in our homes, and I have them on that little turn the knob, and every time they go to take the shower, you got to turn the little knob, put the bathroom fan on for 45 minutes. Plus, it's sort of a poor man's way of giving me an exhaust-only system to make my house sort of net negative under pressure to be so that the house is negative, so it might be pulling in, hopefully, fresh air from a place I want it to pull it in from. You can also buy fan switches for your light, so when you turn on your light, your fan goes on, and you can set them automatically for 15, 20, 30 minutes. EFI, if you're a homeowner, EFI.org has those at a very reasonable price. So what I know is that we have really pretty good data from schools and offices. I've been a little on the fence about how important ventilation is, and I've gotten convinced that it's important, that we got to do it. The choice of not doing it is a way riskier choice. We have to ventilate, and we can see that that's definitely going to make us healthier. It's more important when we end up with these high occupancy settings, whether we're in homes, schools, multifamily buildings, it even becomes more important. More ventilation is better than less, although there is a point of diminishing returns, and that's really hard to find that exact point. It really is variable. My best guess is about 10 to 20 CFM, cubic feet per minute per occupant. That's probably the best guess of this. And I have 2 minutes, and then I'm going to say there are a whole bunch of health risks that are linked to home. This is the percent of health risks that you can connect to your house. So about 20 million adults have asthma, about 4 million kids in the United States have asthma, and I would guess it's about 10%, 20% of those asthma cases have a home trigger. The things that are the home triggers or the building triggers are moisture, as we mentioned, exposure to pests, cockroach poop and mice poop are basically the triggers, environmental tobacco smoke, dust mites, and wild changes in temperature. So anything that we're doing for buildings to keep us more consistent is going to help on a breathing front. The other big ones are lead, which clearly has a home-related thing. Elder falls, it's interesting, about 15% of the population over 60 has fallen in their home. And as this population is aging, that is something we really need to think about in our design of buildings for energy efficiency. If we want a health benefit, I would prioritize breathing issues and injury prevention, because those are the ones that send us to the hospital with big costs, big costs, and big life changes. And then radon. So I want to, I want to say that this other connection, I've told you that ventilation is really important with buildings. I also want to make the point that just doing energy efficiency actually gives you a health benefit. We have this data best for low-income, the low-income part of our population, which if you're a taxpayer, it turns out you're paying for their health care, so you should care here, right? We all should get a better deal. This is a study actually done in Boston by Debbie Frank, and it looked at low-income kids who get fuel assistance. So I reduced their fuel bill by 20 to 30%. When I pay their fuel bill partially, I get a 30% reduction in what's called acute hospitalization. Those little kids still get sick and go to the hospital, but they don't end up spending multiple nights in the hospital. And that's what costs us all a ton of money in Medicaid, is multiple night hospital stays. So reducing their fuel bills gives me a 30% reduction in multiple night hospital stays. That's amazing. And they're 20% less likely to be underweight for age and length. And we have so much data that shows us little kids who have poor nutritional status early have health consequences all throughout the rest of their lives. So this energy efficiency thing, and Tina, who's in charge of policy, what we can be doing about funding more efficiency and reducing fuel costs is really going to have a health bang for the buck. We can see it. So I'm reducing their fuel bill by paying their fuel bill. When I do weatherization and I change the home and I make the home use less energy, that's like fuel assistance on steroids, right? I haven't just given them a fish, I've taught them to fish. The building now is using less energy. Very conservatively, most weatherization and energy projects in low-income homes will reduce energy by 20 to 30%. And in a recent study that was just done, for asthmatic kids, we've shown if you go to their home with a community health worker home visit to look at these asthma triggers of moisture, pests, tobacco smoke, air fresheners, all kinds of stuff, we can see a reduction in asthma, and it pays for itself. It costs about $1.50 for every, we save $1.50 in healthcare costs for every dollar we spend doing that community health worker visit. When I add weatherization to it, I get even a bigger increase in reduction of asthma symptoms. I get much fewer asthma symptoms. So that weatherization piece is doing something else. Now, part of it maybe I'm just reducing their fuel bills, right, based on the slide I showed you earlier, but it's also, we know we've changed the house. It's, the temperature is more consistent, it's less drafty, there's less moisture generally, so a variety of things are happening there. And then I did a study with 400 homes that we weatherized across the country, and we saw after weatherization, reduced sinus infections, reduced asthma medication use, and overall health improvement, which is people in that fair or poor were in the red column. The pre-column, they're at like 26 and 11%, and a year later, their health is overall improved. So we do know that this energy efficiency work can definitely see an improvement for asthma, particularly in the low-income population and overall health. And we know from other studies that when we fix up homes for asthmatics and we get rid of that moisture, the dust mites, the pests, and all of that stuff, we get fewer symptom days and fewer urgent clinical care trips. This is a great study from Seattle. So I know that fixing the homes of asthmatics makes them much, much better. The question that's interesting for us when we look at this net zero energy homes and energy efficiency homes is how much of those things that I know work for asthma can be built and cooked into our energy jobs. So I think that'll be good enough for now.